Yes. Good morning, everyone. Welcome to today's edition of Kenix Care Conversations, brought to us by Kenix Pharmacy. Today, I'm with all the pharmacy professionals that work with Kenix Pharmacy, and we promise you're going to have a very good time learning about antibiotics. So we're going to learn about the good, the bad, and the truth about antibiotics. Kenix Care Conversations is brought to us by Kenix Pharmacy, and Kenix Pharmacy prides itself as a community pharmacy that is dedicated to providing quality pharmaceutical products and exceptional pharmaceutical care. So today we're going to talk about what antibiotics mean. We're going to talk about what bacterial infections mean. We're going to look at examples of antibiotics. Then, of course, we're going to consider the bad parts of antibiotics and then tell you the truth about antibiotics and how we can support you. So, through Kenix Care Conversations, we're able to provide a space where our patients, our customers can learn about different health conditions and also ask questions, anything that has been bothering you about antibiotics, about bacterial infections, about use of medications. This is an opportunity to feel very free to ask questions and learn about it. So we want you to take care in listening, right? Noting your questions. If there are areas of concern that you have, this is an opportunity for you to note them. And at the end of this program, we'll take all questions. We're going to allocate enough time to respond to questions coming on antibiotics or bacterial infection. So we're going to start with looking at the good part of antibiotics. But first of all, let me introduce myself. My name is Pharmacist Ugonna Ayolugwe, and this presentation I'm going to be having it with
Albert Analyst.
Okay. All right, so let's start in earnest. Antibiotics are basically medications that are used to treat bacterial infections. So whenever you think of bacterial infections, you think of antibacterials. That's antibiotics, there to either kill the bacteria or stop the bacteria from growing. And bacteria are very tiny living organisms that we can find everywhere, virtually everywhere. So they can be on surfaces, on table surfaces, they can be on your phones, they can be on it can be even in our body to either be good for us or harm us. So some bacteria are harmful, like we've said, and these bacteria are the ones that will cause us infections like typhoid fever, that will cause infections like tuberculosis, that will cause sore throats, that can cause urinary tract infection, that can cause skin infection. So bacterial infection can cause so many problems for us, and you can get it from either touching the surfaces that we've talked about, or you have an injury and it's not properly cleaned, or you're touching you have poor hygiene situation, don't wash your hands properly, or you're even having unsafe sexual practices. So it's important we note the symptoms when they come up to know that, oh, these are actually bacterial infections. So symptoms such as fever, your body is hot, the temperature is going above 37, 38 degrees Celsius, you have some pain, you may have a cough or sore throat, you might be having diarrhea or you're vomiting. Bacterial infection can also cause skin rashes, and of course, by the time you have these infections, to make your body very weak and make you tired. So there are so many symptoms that will say, oh, you're probably having a bacterial infection that you have to pay attention to. And that is why antibiotics are very, very important, because if you don't have antibiotics, any of these infections that we've mentioned can easily kill anyone, right? So you can have as little as a small injury, and because it's exposed, there's a bacterial infection, and then it causes bigger problems that can be life-threatening. So antibiotics such as ampiclox, augmentin, ciprotab, azithromycin, septrin, flagyl, I'm sure these ones are very popular, are all antibiotics and must be handled with care, right? They help a lot. Antibiotics are very important because they help to treat the infection. They help to reduce the length of time the infection affects the person. They also help to reduce the severity. So we cannot do without antibiotics. Antibiotics are very critical. And they help people to feel better a lot faster, right? Antibiotics also help, for instance, someone who lives in the same house with you is feeling sick or has a bacterial infection. If you don't take antibiotics, there is a very high chance that you're going to infect that person. But with antibiotics, at least it gives us the confidence that you can treat yourself. You can treat yourself and not infect the next person, right? And then also in group of patients that have that are immunocompromised, the immune system might be affected, right? With antibiotics, you can help protect them so that they're not easily infected by bacterial infections. So we cannot overemphasize the need of having good and quality antibiotics available to us and used the right way. Because if we don't use it the right way, we fall into a lot of problems. Now you might say, oh yes, I use my antibiotics the way I was told, or I use my antibiotics the way my friend used her own. It worked for her, so let me use it the same way. No. Each antibiotic must be properly prescribed and properly dispensed in order to get the best out of them. So there are different ways that you may misuse your antibiotic. And we're trying to avoid that. That's why we're having this conversation to ensure that we're getting the best out of our antibiotics. And the first way is abuse. So take, for instance, you're giving you have a leftover antibiotics in the house. Maybe somebody used that didn't finish their sachet, and you have like 3 tablets remaining. And I say, oh, I'm having little sore throat. Let me quickly take 2 tablets and be done with it. You are using someone else's leftover antibiotic. You're not starting your own afresh. That is abuse of antibiotic. That is using it the wrong way. And then you may be overusing it. There are patients that use antibiotics monthly or every 3 months. They say, oh, it's a routine for me. I have to use it, especially after seeing my period. I like to use antibiotics. I like to use an insert. These inserts contain antibiotics. Not just antibiotics, they also contain antifungals and other components. But specifically for antibiotics, if you have to use antibiotics every month just because you want to, then you are doing the wrong thing. You are misusing the antibiotic. You are making the antibiotic not effective for the rest of us. So if you have a viral infection and you are using antibiotic and misusing it, that's an overuse. You are using it too much, right? And then there's another group of people that underuse it. Think of when you say you have a runny tummy and then you are giving flagyl and then you take 2 tablets and then your runny tummy stops and you stop using flagyl. You are underusing that antibiotic. Flagyl is a very strong antibiotic and must be used with care. So if you don't complete the prescribed dose by stopping early, or saying I'm tired of taking this drug, or saying I'm fine, I feel fine, I really feel better, why should I take the drug? Yeah, abusing it. It's important that we completely use our antibiotics exactly as prescribed to avoid life-threatening consequences. Number 1 is that if you give the bacteria an antibiotic that is not up to what you're supposed to give, you make the bacteria become used to that antibiotic. The bacteria becomes stronger than the antibiotic. So the bacteria has learned your tricks, right? So the bacteria becomes stronger. That's what we call resistance. The bacteria is now resistant to that particular antibiotic. And this does not affect you alone. It affects the next person. It affects your brother. It affects your sister. It affects your mother, your father, your children. It affects them because it's the same organism that we are dealing with. So if that particular organism is now resistant, if that particular organism is now stronger than the available antibiotic, you will notice that it will not work again should you use it or should another person use it. And you don't want that. You don't want to have life-threatening situations because of bacterial infections, right? And then you end up having treatment failure. You will not properly treat that infection. And you will spend more money because if you don't treat it properly this time, the next time you're going to buy a higher one and you're going to be spending another money. And we don't want that. We want to be able to use the available to treat bacterial infections we have completely. And then you can increase the risk of death because if the infection is not properly treated, it can become worse. The patient has complications and the patient can die from it. It will just feel like when we didn't have antibiotics in the system. We don't want that. And then you can come down with side effects or allergic reactions. If you misuse your antibiotic, it can lead to allergic reactions that can be avoided. right? So as much as possible, please, let's not abuse, let's not overuse, and let's not underuse our antibiotics, because you're supposed to use it only when prescribed and exactly as prescribed. And it's important you buy it from registered pharmacy, like Kenix pharmacy, where you can find registered pharmacists that are well trained and qualified to explain how to use these medications, when to use these medications, and why you should use these medications. And the onus is on you to follow the instructions carefully. If you have any questions, if you have any clarifications, you have the right to ask questions and it will be well explained. Now, if you have an antibiotic that you've bought one pack, you have 2 children, for instance, that are having the same condition, similar conditions. Oh, they are both coughing. 2 children in the house are coughing. You have to ensure that each child has their own antibiotic that they use completely. Because I've seen situations where a mother buys a bottle of antibiotics and then says, oh, let them share it. And at the end of the day, medication that's supposed to be taken for 5 days, 7 days, they end up taking it for 2.5 days. You are causing problems for the family, for the whole family. You're causing problems for everyone. So it's better you make an economic choice. You can agree with your pharmacist to give you a brand that you can afford 2 of it, so that we ensure that we're using complete medications for both children. And don't use leftovers. It goes without saying. Do not use leftovers. If you have a complaint, if you have a concern, come and make that complaint known, so that you'll be cleft properly. Questions will be asked to find out the right antibiotic to be used. Don't assume because it happened to my brother the other time and he used this antibiotic is going to work for me. No, it doesn't work like that. Everybody's different. Everybody's system is different, right? So the medication can be different and the dosing can be different. Even the dosing duration can be different. And that's why it's important you don't use leftovers. Come and make your complaints, and then the right antibiotic will be recommended to you. If you're having any side effects to any antibiotic they're using, please report to your pharmacist. Please come to Kenix Pharmacy. We're more than willing to address your side effects and tell you whether you should stop, continue, or modify the way you're using your medication. And most importantly, it's very important that we combine with a very healthy lifestyle. So eat well, eat clean, rest, take a lot of water, and take good multivitamins. Good multivitamins to help you and the drug work a lot better. There are so many options of multivitamins, and we're going to discuss the ones you're going to use with different antibiotics and the one you're not supposed to use with different antibiotics. And that's why it's important that you meet registered pharmacists that is going to explain these things to you. So Anna is going to take us up on the role of multivitamins in bacterial infections.
Okay. Now, multivitamins play a very huge role in fighting against bacterial infections by boosting your immune system. That is why we always recommend multivitamins alongside antibiotics. Now, multivitamins can come in form of tablets, capsules, or even gummies. They contain various vitamins that are very helpful. It helps your body's defense system to fight against bacteria and even other infections. Now, these vitamins include vitamin C, vitamin E, vitamin D, and other micronutrients like zinc and selenium that will help to boost your immune system against bacterial infections. And you'll be like, oh, fam, but I eat enough vegetables and I take enough fruits. It is not enough. These multivitamins, you cannot get the right quantity from just fruit. You will need like a whole wheelbarrow of fruit for you to get those nutrients that your body really needs to fight against these infections. That is why we recommend multivitamins each time we give you antibiotics. Then it also helps your body recover faster, right? During an infection, the body is under stress, either through diarrhea or you lose weight, there's fever. So this multivitamin helps to replenish those lost nutrients that you may have. It also helps boost your energy and reduce fatigue. Vitamins like vitamin B12, B6, iron, it helps support energy production and fight fatigue. Also, antibiotics helps, multivitamin helps antibiotic effectiveness. While multivitamins do not actually treat the infection, but they can boost your immune system. They can help your body respond better to antibiotics treatment by keeping your immune system very strong. Now, when you walk into our pharmacy, we don't just give you drugs and let you go. We try to educate you on how you take these antibiotics to get the desired results. There are some certain foods you don't take with some certain antibiotics, and we're going to look at some of them. Food like milk, cheese, dairy products that are very rich in calcium. You don't take them with antibiotics like tetracycline, doxycycline, ciprotab, right? You don't take dairy products with those antibiotics. Why? Calcium in those food antibiotics and reduce the absorption. Your body doesn't take in enough of those drugs that will make it work. Once your body does not absorb those drugs, that means you are wasting your money. You see some people coming, ciprotab does no longer work for me. It is because of the kind of food you ate while taking those antibiotics. So you avoid dairy products. Some people even take ciprotab with parfait or yogurt. You take 1 liter of yogurt with your ciprotab, it's not going to work for you. And once your first dose is already messed up, you need a complete dose. It's not like NSAIDs or anti-inflammatory drugs like ibuprofen that you just take 1 or 2. When you are fine, you dump it. No. Antibiotics is a complete dosage regimen. So you avoid dairy products 2 hours before or after antibiotics. We have grapefruit juice, fruits that are rich in vitamin C, ascorbic acid, like oranges, watermelon, they are very rich in ascorbic acid. So you avoid those foods when you are taking antibiotics like erythromycin and some fluoroquinolones like ciprotab, ciprofloxacin or floxacin. You avoid these fruits because it interferes with liver enzymes. In the liver, drugs are metabolized. So once these enzymes are being interfered, the drugs are not being metabolized. So there's increased side effects in such scenarios. So you need to avoid these fruits during when taking antibiotics like this. So alcohol, some people will tell you, I have a meeting this evening, I need to drink, or fam, can I take? You need to avoid alcohol when you are taking drugs like metronidazole, which is flagyl, tinidazole, and some cephalosporins like your ceftriaxone, cefixime, even ceftriaxone. You need to avoid alcohol because it can cause nausea, vomiting, cramps, headache. So avoid alcohol during and 48 hours after treatment for you to be able to get the desired result. Then high fiber foods like beans, whole grains, your coke and oats, please avoid them because they can slow down or reduce absorption of most antibiotics we have. So you space your meals, such meals that are rich in fibers and other antibiotics doses by few hours. Then we also have iron or calcium supplements, your blood tonics. Please, while you are taking your blood tonics, don't take them with tetracycline or your ciprotab because it binds to them and reduce their effectiveness. You take supplements that are rich in iron and calcium supplement 2 to 4 hours apart from your antibiotics. Then we also have herbal products. Those of you that like taking, if this one does not work, this one will work, like your roso bitters, your yo-yo bitters, ginger, ginseng, and even those our local agbo sellers. Please, you avoid them. They can interact with various antibiotics we have. They can interfere with their metabolism and increase your side effects. So always inform your pharmacist or your doctors on the herbs you are already on, so that they will know how and which antibiotics is right for you. Then aside interaction between some food and some antibiotics, there are some antibiotics you don't entirely take with food. Like erythromycin, you take it on an empty stomach, right? So that because food will reduce the absorption, you just take it on empty stomach. Then amoxicillin, you can take it with or without food because food does not really affect it much. Augmentin, you take augmentin, then immediately after you eat to reduce the stomach upset, stomach irritation. Because if you take augmentin without eating, it can irritate your stomach. Then we also have drugs like antibiotics like tetracycline, like your doxycycline. You take them on empty stomach. You take them on empty stomach. Then your flagyl, you should take flagyl with food. It helps to reduce nausea and any aftertaste you may have when you take these antibiotics. Then your ciprotab, we said it earlier, that you should avoid food that are rich in iron and calcium when you are taking your ciprotab because it will reduce the effectiveness of this drug. Now, the power is in your hands. We've seen the various importance of antibiotics. We've seen that antibiotics can be very, very useful when we use them appropriately, when we take them at the right time, right? So antibiotics can save lives when used correctly. They reduce infections, they cure infections, in fact, and reduce complications and make modern medicine possible. But when you misuse it by either abuse, misuse, underuse, it can lead to various consequences, especially that of resistance. You become resistant. We have people that come with their sensitivity tests to the pharmacy and they are already resistant to a long list of antibiotics. You don't want that. And once you are resistant, you are not only putting yourself at risk, but you are putting others at risk of getting resistant bacteria, right? So we want to avoid that. So we are here to support you with the truth. Getting the best out of antibiotics does not only depend on you, but on where and how these medicines are sourced, dispensed, and monitored. So here in Kenix Pharmacy, we do more than just sell drugs, right? We source our antibiotics directly from trusted manufacturers and distributors to avoid fake, expired, or substandard drugs. We pay attention to detail. Even as little as our drug storage, we store our drugs properly to avoid any effects on the antibiotics, right? We also keep accurate records to track antibiotics. We follow up on our patients. That is why our office lines are always available for our patients to always call. We always call to even check up if there's any allergic reactions. We are always there for you. Then we also educate our patient thoroughly on how and when to take their antibiotics, very importantly, so that you will have the best result. We tell you how you take, we give you the right antibiotics for your symptoms, right? Then we also offer professional guidance. We are a team of over 6 qualified pharmacists. So you can walk into any of our branch with your symptoms, with your complaint, or your confusion. We are there to help you. So with this, if you have any questions, we are here to answer you. Thank you.
Thank you very much. So we're going to take questions now. Please feel free to write down your questions on chat box or on mute to ask directly. Any question on antibiotics or bacterial infections? This is the time to ask. Or on our presentation, if there's anything we've said that is not well understood, that you need us to touch on again, we would like you to come up mute and ask questions. Thank you so much for joining. Satil, Jovita, Obeyemi, if you have any questions, please ask.
Hello, good morning. Can you hear me?
Good morning.
Okay, my name is Isaac. Thank you so much for the session. It's educative. So I have a question. You said that when you abuse these antibiotics, it's not just you, but people around you is at risk. So I want to know how it will affect people around you.
Okay, thank you very much, Isaac. Okay, so Isaac was asking, we mentioned that if we abuse antibiotics, it doesn't just affect us, it affects the people around us. Yes, so like I said, the bacteria you're trying to treat or eradicate is a particular bacteria that can affect another person. So if you don't take your antibiotics properly, that organism becomes used to that antibiotic. That particular organism becomes used to that because it's the same bacteria, it's the same drugs available, right? So if you don't take your antibiotics well to completely kill off that bacteria in that infection, the bacteria feels stronger than that antibiotic. So the bacteria can easily, by the time it infects another person, the person close to you, right? And that person takes that particular antibiotic, the organism there will already say, oh, I've seen this one before now. This one is no longer a big deal to me. And be able to defeat that antibiotic. So it's important that you kill it and kill it completely. So the next time the organism comes in contact with that antibiotic, it will know that this one is stronger than I am. Do you understand? So it affects that next person if you don't take it properly, because the organism will become resistant, become stronger than that particular infection. Sorry, stronger than that particular antibiotic. I beg your pardon. So Isaac, do you understand it? Was I able to answer your question?
Okay, it's the same bacteria that can affect other people.
It's the same bacteria.
Okay.
It's the same bacteria, yes.
Yes,
it's
clear.
The same set of bacteria, it's the same set of antibiotics available. Yes. Before you have a new antibiotic, you need like how many years? I don't think we've had a new antibiotic in so long. So the ones we have available are the ones we can use. So it's important to take very good care of them and use them appropriately to ensure that they can kill, they can eradicate, they can stop the growth of the microorganism. So does that answer your question?
Yeah, thank you so much.
You're welcome. Thank you, Isaac, for joining. We're looking forward to more questions. You can unmute, you can put it in the chat box.
Please, I want to ask again. So at what point do you go to the hospital?
At what point do you go to the hospital? If you have a bacterial infection and you're not responding to oral antibiotics, you can always go to the hospital.
Okay.
Hello? Please mute. It's like most of our attendees are just joining. What? To join. Yeah. Okay, we'll just wait for questions. Welcome, Kemakonam. If you have any question on
Contribution.
yeah, questions or contributions or need for clarification, please ask on bacterial infections and antibiotics. Not seeing any other questions. Joining. Any more questions?
That's what you do. That's the person wants to be named. The person wants to be talking.
What do you mean? Okay. If you don't have any more questions, we might have to close. You can send the recordings to people that attended.
I have another question. Hello?
Yes,
Hello?
please, go ahead.
Hello?
We can hear you, sir.
Okay. I was having running stomach, and I took flagyl. The running stomach stopped. And I didn't take the flagyl again. Is there any negative effect of it?
So you had running stomach and you took flagyl.
Yes.
For how many days? How many times in a day and for how many days?
I just took it once.
Okay. So yes, like we said, flagyl is an antibiotic, and you fall into the category of underuse because you did not completely take the prescribed dose and you stopped early because you felt better. Excuse me. Like you rightly said. So the negative effect is that, again, is that you are creating resistant strains of that bacteria. You're going to incur higher costs because if you start having another ronitum, you have to spend extra money to treat yourself. So to avoid antibiotic resistance, that is when the bacteria becomes stronger and does not respond to flagyl. It's important to complete your dose. So it's important to take it 400 milligram 3 times in a day for at least 5 days. So to answer your question specifically, the negative effects of using your flagyl once and stopping is that you're going to make the bacteria stronger than flagyl subsequently.
Okay, someone has a question.
Clear. Thank you so much.
You're welcome, Isaac. Thank you very much.
KK asks, please, I have a question, ma. For instance, you are taking antibiotics and then you miss 3 days because you were out of town and you forgot to travel along with it. So, is it advisable to continue with it when you are back? So, it also falls within the category of underuse. You've already missed you took it for just 3 days, or you missed 3 days rather. You need to start all over again to be able to take care of the bacteria that is causing it. Traveling and coming back, you've underused it already, and you've seen the consequences. Is the same question with the other one. So try and always complete your antibiotics. Don't take half and leave half. Even if you travel, maybe when you get to the park, buy another one and make sure you complete for the particular number of days. Sorry. We are treating a bacteria, it's a living thing, and it requires a certain number of doses to kill it. So you need to complete it. I hope that answers your question.
Ask your question. Hello?
Hi, Jovita.
Hello, good morning, ma.
Good morning.
Please, I want to ask about that antibiotic. People said that if we take it much, it will affect our people that is closer to us. How can we treat the sickness so that it will not affect them? And how can we take the antibiotic? Like how can we how many doses we can take to prevent all those?
Okay. So your question is, I'm going to let from Uche respond to the question. So her question is, in order to ensure that not taking your antibiotics completely affects someone next to you, how can you do it right?
Okay.
Is that correct, Jovita?
Yes, yes.
That question. All right.
So what you should do is, one, the first thing is you should try and make sure that you take the antibiotic completely. Whenever you miss the antibiotic and you remember, you try and continue the course of the therapy immediately, or rather you visit a qualified pharmacist to advise you. So here at Kenix Care, we have very experienced pharmacists that will help you advise you on how to take your antibiotic. Then also, secondly, you don't share antibiotics with others. It's not a multivitamin you can share with other people. You take the full course of your treatment. Then you only take antibiotics when prescribed. You make sure that you take it only when it is prescribed. And also, you buy from a registered source. Okay. And also, when you buy from a registered source, you make sure you follow the instructions carefully, just like as Farm Ann has said previously. You don't take some antibiotics with certain foods, certain fruits, and also you take the full course of your antibiotic therapy. And also you add some multivitamins when needed in order to help boost your immune system and also clear the bacterial infection properly, so that it doesn't come back and become stronger, because they said what doesn't kill you make you stronger. That's what bacteria does. So I think I've answered the question.
Okay, thank you so much. I want to ask another question because my daughter, 11-year-old girl, you normally have cold. You know me, you know me well. I normally come to your pharmacy to buy drugs about this cold. So what can I do to prevent the cold?
Okay. So the cold is something that comes with weather most times, and cold can be caused by sometimes a virus, influenza virus, which is self-limiting. But when it keeps reoccurring, you may want to suspect some other bacteria, just like strep, pneumonia, and other. So the first thing you do, you try to run a test on her. Like there is a test called an titer test. If it's positive, then we'll have to treat with an antibiotic, then also help boost our immune system with multivitamins and vitamin C. The child needs to be on it on a regular basis, you understand, in order to get full recovery. And she has to take the full course of the treatment if she's positive for the test.
Okay. So how can I get this thing to do the test?
Okay, you can go to a lab, you can meet a pharmacy at Kenix, and they will refer you to a lab.
And don't worry, I will come and meet you people. You are my doctor and my nurse.
Yes, well, thank you very much.
Jovita.
All right.
Yeah, some home interventions you can also do is to protect the child from cold. So as little as putting on their socks, covering their hair, especially now, the weather is very cold, not just for children, but for adults as well. Okay. So as much as possible, wear her stockings, put on a what's it called? Warmer. Yes. And then avoid taking cold drinks, including water. So her water can be warm to make sure that her body is a lot warmer and not as cold.
Okay, ma. Thank you so much.
You're welcome. It's our pleasure.
All right.
Okay. So are there any more questions? Concerns, need for clarification? Please feel free to unmute and ask your question. So a lot of people trying towards the end, but we have it recorded, so we're going to share it with everyone. Okay. You're welcome, okay. Any more questions? Can we close? Any more questions? Fine. Country is equal to our final charge. Okay. Someone is talking. Okay. Francis, go ahead.
Okay.
Go ahead. Thank you, everyone.
Okay. Good noon, everyone. It's ready to PM. So, thank you all for joining. Thank you all for making our time to join our conversation. We've been doing this since last year or last 2 years. So this is like the fifth or the sixth one.
Sixth one.
The sixth one. So Kenix Pharmacy always got you. We got it covered. And we'll we'll do more. Because it has been our lifestyle now. It's part of our lifestyle now. It's our lifestyle and always doing. So we'll do more. So thank you all for joining, and you're always welcome. Feel free to come to Kenix Pharmacy, ask your questions, ask about antibiotics. How do I take them? What do I do? Why do I give them? You're always welcome. We'll answer you. Thank you very much, everyone.
All right. Thank you, everyone, for joining. And special thanks to Kenix Pharmacy for giving us this platform. We have all our team members here. Come, guys, come, guys. Look, I don't say right. Can we help you too? All right. Thank you, everyone. Bye. Thank you.